Hi there, I hope your day is going great. I would like to answer some common questions about chemotherapy and my experience with it from a patient's perspective. I'm not a medical doctor, I'm not giving medical advice, I'm sharing my experience. So, some common questions. What kind of drugs will I be given? How long will my chemo last? How often will I get it? And what kind of side effects can I expect? So, first, the kind of drugs you are given is very different between different cancers. So, I had colon cancer, which is fortunately healed now, and I had a certain chemo regime for that. And then, unfortunately, I got liver metastases, which happens in 50% of colon cancer patients. And then I had another chemotherapy regime. And then, now recently, my oncologist put me back on the first regime because the second one wasn't very effective. So, common chemotherapy drugs include fluorouracil, which is an infusion bottle that gets attached to your port. I have a port inserted. It's an IV that's implanted under the skin. And I have another video where I explain the ins and outs of the port and how to handle it and how it feels and what it's like. So check out that video. I'll link it in the description below. So that was fluorouracil. Then leucovorin, and then possibly either oxaliplatin or irinotecan. So, side effects on these drugs. The most common side effect on most chemotherapy drugs is nausea and vomiting. So, it's very important that you prevent the nausea as much as possible. It's called prophylactic treatment. So, I take 2 or 3 anti-nausea medications. The first one I take an hour before the chemo starts. I take it at home. It's called Emend. And I take that for 3 days, every day in the morning on the first 3 days of my chemo cycle. And that is highly effective for me. I feel a little nauseous, but I'm not I'm not vomiting or anything. One thing that I can tell you is once you start vomiting, it's hard to stop it. That is why the doctors give you these preventive treatments. Another drug is ondansetron. I take that at the clinic, 1 tablet at the clinic, and then at night, on the first night, I take 1 tablet of ondansetron. And those are my antiemetics, as they are called, anti-nausea medications. So nausea. Another side effect that I have is fatigue. I feel very tired, especially in the first week. So I do strategize my work in my home. I have to help my son and I have to cook meals. I do outsource some of my meals by asking my husband and my son to warm up something. My son is now a teenager, so that's very helpful. He's helpful in the kitchen. And my husband is fortunately very good in the kitchen. So I plan ahead and I make sure that ingredients or ready meals are there in the fridge for them to just warm up. Then another side effect that I had on irinotecan was diarrhea. And you can get dehydrated easily with diarrhea. So first of all, you have to stop the diarrhea. So there's an anti-diarrhea medication called Imodium that I take, and it works within half an hour. And then the diarrhea stays away for a day or two. And then with the dehydration, now this can be very serious. You can end up in hospital with dehydration because it causes you to become dizzy and you pass out. You faint from dehydration. So it's very important to stay hydrated. And another side effect that impacts the hydration issue is the fact that water tastes absolutely horrible, especially in the first few days. It tastes like rusted metal when you try to drink just normal water. So what helps me is I make myself some tea with a bit of honey. If it's a little sweet, it's not that bad and I can get it in. You have to drink at least a liter or two of water if you had diarrhea, especially. Stay hydrated, that's really important. Another solution that I have for the dehydration is that I take Pedialyte. It's not just for kids, it's for adults too. You can buy it on Amazon in a liter bottle, or you can buy the powder form, which you dissolve in a big jug of water or in 500 mils of water. That's important to take. It gives you your electrolytes back. That really helps. So that's a bit about the side effects. There are other side effects as well, very specific to oxaliplatin, including peripheral neuropathy, which is pain and numbness in the feet and hands. And for me, unfortunately, it happens with some patients that the neuropathy and the tingling and pins and needles and numbness is permanent for some people. Unfortunately, it's permanent in my feet, in my toes especially. Fortunately, not in my hands, so I still have the use of my hands, but keep an eye on it and be aware of this and make your doctor aware of this if it becomes severe, especially in your hands. You don't want to lose function in your hands. But you might not even be on oxaliplatin depending on your type of cancer. So don't worry about it too much, just be aware. So how often? So my chemo cycle is 2 weeks. So I get my chemo treatment at the clinic on a Monday, and then I rest for a week. It takes me a week to recover, and then I rest for a week, and then after 2 weeks, I have another cycle. So that's the kind of frequency. And then how long does it last? So now this depends again on your type of cancer and how far your cancer has progressed. So with me, with my colon cancer, my doctor prescribed neoadjuvant chemotherapy, which means before your surgery. So that was 6 cycles before my surgery, and then I had adjuvant chemotherapy, which was after my surgery, another 6 cycles. Sometimes you'll have 12 cycles before your surgery. It all depends on your specific situation. I'm just sharing what I experienced. I hope these few ideas help. Have a wonderful day. Stay safe, stay blessed. Bye.